It was just pretty much chaos from the first day. I just wanted to pull the blanket over my head and pretend like it wasn't happening anymore because it was so disturbing.
New claims are exposing even more problems at Monterey County Jail, a facility already riddled with issues.
The turnover rate for the medical staff is outlandish. No one stays, for the most part, past their third day.
I couldn't believe my supervisor actually told me, "You just care too much."
Two nurses agreeing to talk to us under the promise we don't show their identities describe a bleak situation at best. They say the private healthcare provider WellPath, the County of Monterey, and the Sheriff's Office are not prepared or equipped to handle this situation festering behind these fences.
The nurses making claims of abusive employer practices and neglect of inmates due to severe staffing shortages.
It's a safety matter.
This nurse, currently employed at the jail, who we are calling Joe, says right now there are not enough staff members to deal with even serious requests.
There have been patients who have had broken bones that won't be x-rayed, set, even looked at for weeks. There's inmates right now who have broken bones where we legally cannot tell them we failed to x-ray you in time and that will need to be rebroken to be not disfigured.
Another nurse, who we are calling Jane, is opening up about suicide prevention inside the jail. Some nurses who put inmates on suicide watch received tremendous pushback from deputies who balked at the extra work involved.
What did that behavior look like?
Very irritated. First it would be the deputies, and we'd say, you know, we're just following our policies and procedures. And so they might go to another nurse. If the nurses insisted on putting them on suicide watch, then they'd go to the sergeant. And then we'd get a call from the sergeant saying, why? This doesn't seem necessary.
There have been at least 28 in-custody deaths at the jail since 2015, at least 9 of them suicide, even though there are policies in place to prevent them.
Because of the staffing and the resistance, I mean, they would try and talk us out of it.
It is a common trend that the deputies I do work with are working 3, 4, 5 days a week, 16-hour shifts.
In a county facing a $26 million budget shortfall this year and another $37 million the next, wrongful death lawsuits are plaguing taxpayers. 5 lawsuits between 2013 and 2019 resulted in $9 million in total judgments and settlements. 4 lawsuits for deaths between 2021 and 2023 were just settled with the County of Monterey for more than $4 million total, along with a larger private settlement from WellPath. 4 other lawsuits are still working their way through the courts.
Regardless of why they're there, they're still human and they need to be treated as such. And when they need health care, they need health care. And we can't dismiss that. I would question the whole management and the whole system that they have in place right now. Just the lack of care, the lack of organization made it so that we couldn't perform the duties necessary. There were nurses that were, I know of one individual that had worked 24-hour shifts multiple times, and I said, I didn't even think that was legal.
These nurses now offering a first-hand account of the treatment of inmates and their living conditions, Jane offering dark details about one mentally ill inmate living in his feces for at least 2 days.
When he defecated, he took some of it and covered the window so we couldn't see in. And it was absolutely pungent. I could smell it very well through my mask on the other side of the door. I was told was, oh, that's a painter. And that's what the staff referred to them as.
And there was not much that you could do?
No, I didn't have any authority to tell somebody we have to clean that up. You know, I questioned it and I said, well, are we going to do something? And they're like, well, they put it there, they got to live with it.
Joe is also opening up about the challenge of caring for inmates suffering from mental illness while behind bars.
We have a very large mental health problem that is being serviced in the jail for lack of other resources. The mental health providers are kind of handicapped in this situation because what they would like to do and what would be research and evidence-based practice cannot happen in corrections.
Why not?
Security risk, among other things.
Jane showed us emails she sent her bosses at WellPath where she laid out the problems with the quality of care, staffing shortages, and poor training. She says significant changes were never made and that trainings would be planned and then suddenly canceled.
What was the reaction you got when you requested to have more training?
I was told I was a smart girl, I could figure it out.
According to Jane, she was fired after she requested and then took a restroom break following 10 straight hours of doing intake.
I went in on my day off, and the supervisor just told me, "We're going to term you." And I'm like, okay. I wanted to stay there and keep doing what I could, but at the same time I was kind of relieved because I knew that I would keep pushing myself.
What would you say to those people who might watch this and just say, well, she's just speaking out about her former employer because she's mad that they fired her?
That I'm a disgruntled employee. Well, I would say if that were the case, why was I documenting from the beginning? Because I was concerned.
Federal court documents show WellPath and the jail are out of compliance with the 2015 Hernandez settlement in at least 43 areas. Many of the problems were kept a secret until a judge ordered the county to unseal thousands of pages of documents, as KSBW reported in March.
It was festering. It was bothering me, and I had seen your report just a couple weeks ago, and it was like kind of just the last straw. Every time I hear anything or I see an article or I hear something on the nightly news, it eats at me till the point where I felt like I had to reach out and say, yeah, this is wrong and things need to change.
I want to see the right thing done. And it seems as though all larger healthcare organizations have a very removed mindset of what happens on the front lines and what happens on a spreadsheet are the same. They are not.
Paul Dudley, KSBW, Action News 8.